So that leads us to a discussion of inferior trunk or lower trunk injury. So that's going to result in a loss of all hand muscles, regardless of whether they're median or ulnar. So the thenar muscles, the hypothenar muscles, the lumbricals, the interossei, all of them. So you'll have a loss of opposition, you'll have a loss of abduction, adduction, you'll have a loss of your thenar muscles, you'll have a loss of all your lumbricals. And we said that the lower trunk can be the cause, an injury of the lower trunk could be the cause of that. That syndrome is known as Klumpke's paralysis or Klumpke's palsy, and that can be caused by either upward traction of the upper limb, stretching the lower trunk, or by compression of the lower trunk against either the first rib or if the patient has a cervical rib. So that's sometimes called a thoracic outlet syndrome, as the lower trunk leaves as T1 in particular leaves the thorax to get into the neck and then down in the axilla, it has to cross over the first rib. And the counterpart of a lower trunk injury would be an upper trunk injury. So we know that the upper trunk is C5 and C6, and we know that the C5 and C6 is what innervates all of the proximal muscles, the muscles around the shoulder and the axilla. And since the major function of those muscles is to abduct and externally rotate, you'll have a loss of abduction and external rotation at the shoulder. And that means that the limb will tend to be held in the opposite position, which is adduction and internal rotation. And that's been given the name waiter's tip sign because it takes on the appearance of a waiter, suggesting that you slip him a tip. The most likely cause of an upper trunk injury, which is also called Erb's palsy, E-R-B'(S), Erb's palsy, is traction that tends to pull the head and neck away from the shoulder, traction in this direction like that, stretching the upper trunk that's passing from the neck toward the axilla. So injuries such as being thrown from a bicycle or from a motorcycle or from a horse, in which the patient then strikes the ground with the head going that way and the shoulder going that way, might do it. And a very common way of getting an upper trunk injury is as a result of obstetric injury. When the baby's head presents in the birth canal, if the shoulders get stuck in the birth canal, if the obstetrician manipulates the head too forcibly to try to pull the shoulder free, can cause a stretch injury to the upper trunk, resulting in Erb's palsy.